Park. I'm the program director for the Master's of Athletic Training program, and I want to introduce Chandler Ingram. He is a Master's of Athletic Training student, and he's going to do a presentation on ankle injuries and athletic training coverage for marching bands. Chandler?
Awesome. So, like you said, my name is Chandler Ingram. I'm a Master's in Athletic Training student, and this is my JSU Student Symposium presentation on ankle injuries and athletic training coverage in marching band. So a little bit of information on the ankle injury itself. Ankle injuries consist of almost 40% of musculoskeletal injuries in sporting events, such as basketball and soccer is more of your contact sports, as on the other end of the spectrum you have cross country and your performing arts such as dance and ballet for as your non-contact sports. But the mechanism of injury, or how the injury happens for an ankle sprain, is when your ankle is forced into a plantar flex position, which means that your toes are pointed down and your center of gravity in your body rolls over that ankle joint, causing a stress on the ligament structure. So with that being said, that plantar flex position is also known as the open pack position. This basically means that there is not a lot of contact between the structures of the ankle joint, and that means that there's a lot more give, a lot more room for the structures to move, causing the ankle sprain to happen. And if these ankle injuries occur multiple times or they're not treated properly or correctly, that can end up progressing into a more chronic condition that takes long to progress, called chronic ankle instability, which is basically when you have a continuously giving away aspect of the ankle joint. Basically, the ligament structure isn't able to keep the ankle joint together and lets the structure move more frequently. Moving on, so what is marching band? Marching band is a teamwork-based activity where performers perform outdoors, and it's based off of a militaristic background. The members of this activity will normally play an instrument, and while also playing that instrument, they're also performing things like choreography and then making these cool geometric shapes pleasing to the eye to the audience, as we see in the picture shown. So within marching band, there's visual techniques that each member is taught to be able to move across the field to perform these actions, to make these shapes and things. So we call that visual technique. Normally when we take our first step, the first step is a heel contact. So it's always very militaristically styled. Take a heel contact for the first step, but when we move, say, laterally or side to side or backwards, we're on a platform, we're on the balls of our feet, and it's said to help with, if we fall, we have a way to catch ourselves. But with that being said, that ends up being possibly like helping or increasing the chance of injury to occur when we're on that platform. Because like I said, we're in this plantar flex position, the structures aren't close together, and then the structures don't have as much space to move, or have more space to move, so the injuries are more likely to happen. So backwards marching, this is when we use to march backwards, as stated, and it's executed by being on that platform, having an erect upper body, and we're avoiding things like squatting, leaning, slumping, and bouncing. And as we see in the picture, she is on that platform and could be at the risk for injury. So for this step, it's called crab stepping. It's normally utilized by marching percussionists or the drum line, and it's used to move laterally to keep the instrument in front of the body to where all the sound is projected forward instead of turning side to side where you won't hear it as much. And again, the movement is executed by being on this platform. So again, we still see that the foot is in a plantar flex position, causing more likely to have an ankle injury to occur. So jazz running, this is a technique that's used more like the color guard. So if you see all the flags and things like that, it's normally utilized by them to gain greater distances while also maintaining like an upper body posture. And again, in the picture, the foot is turned outward, but she is still on that platform while performing this action. So again, the structures aren't as close, there's more room for give, so more likely for an ankle sprain to occur. So now the profession of athletic training. So what is an athletic trainer? An athletic trainer is a healthcare professional that prides itself, is very efficient in prevention, examination, diagnosis, treatment, rehabilitation, emergency care, and also as well as referrals if injuries have occurred. So as far as the clinical scenario, marching band visual technique could possibly put its members at risk for injuries. And in the marching band setting, athletic training coverage is very limited. You don't see athletic trainers in marching band or at the shows or anything like that very often. And the skills that they provide and techniques can also help with treatment and prevention of these injuries to where we can prevent chronic ankle instability from happening and occurring. But due to the lack of research, changes in marching band technique and athletic training should be done to, one, help provide healthcare for a member population that doesn't get healthcare very often. So my focus clinical question is split up into two parts. In high school and collegiate marching band members, how are lateral ankle sprains and chronic ankle instability prevalent? And how do high school and collegiate marching band members benefit from the profession of athletic training? My population is high school and collegiate marching athletes. My intervention is athletic training coverage and techniques. I don't really have a comparison because I'm not comparing any type of intervention. And my outcome is the prevalence of ankle injuries. As far as my search strategies, there are a couple of databases I used. I used JSU Library, Sports Discuss, PubMed, Google Scholar, and just some simple Google searches due to the limited amount of research. My search terms include marching band members, marching athletes, marching band injuries, musicians, and ankle sprain. As far as my inclusion and exclusion criteria, the inclusion criteria included articles talking about ankle instability, marching band, and articles that were published in the English language. And as far as exclusion criteria, if it dealt with any type of musician that wasn't in the marching band setting, I excluded it. So if it included pianists, organists, drum set players, anything like that, I excluded it. So it had to be strictly on the marching band aspect to do with the technique. And as far as exclusion, there was no exclusion criteria as far as published date due to the lack of research that has been done on the marching band population. So these are the three studies that I used. The top two studies are very similar in the way that they were conducted, but they just have different purposes and what they were looking for, which we'll get into in a few seconds. So the first article was titled Marching Athletes. The purpose of it was to describe the frequency and types of injuries that the marching band or high school marching band during the band camp period that everybody is very familiar with, that they sustained through that week, and then they compared it on a 2-year span. So they took the injuries, how many injuries they had 1 year, and then compared it to the second. And then the results, most common complaint was lower musculoskeletal injuries, which includes ankle sprains. So this was the results of it. As we see, the top, if not first or second, lower extremity injuries were the highest percent of injuries that occurred during that 2-week period of band camp. So the second article is titled Marching Band Camp Injury Rates at the Collegiate Level. So I said that these two studies were very similar. They were conducted in a way where the student or the member would self-report an injury if it happened. So if they had an ankle sprain, they would come up to the healthcare professional or the director and say that injury occurred. That being said, that also means that some people may not go and present that injury to the medical professional, which means that's just an unreported injury that had happened. So more injuries could happen that just weren't reported. With this one, they just focused a lot on the injury rate from section to section, and again, purpose recording marching band injuries over the course of 1 week, which is that band camp period, to determine the injury rate for that preseason, which is where band camp is normally done. So the results, a total of 191 injuries reported in 1,540 practice exposures, and then we just get into the differences in overall and compared to male and female. So this is the injury rates as far as each section, and we see that trombone or mellophone is one of the higher ones, but that second or third is the percussion section right here. So we see that they have 184 injury rate for the percussion, which is the third highest, which again is one of the sections that use that technique. So this is really like an expert opinion. I just got this as information on getting my mechanism injury, the issues with chronic ankle instability, how it occurs, just some basic like information just to kind of prove my point as far as anatomy stands, which is basically using all the background information I use. As far as the clinical bottom line, ankle injuries are present in the marching band activity. Athletic training coverage could be beneficial in managing and preventing these injuries, but we see that there is a limited healthcare provider for that activity, and there's limited research done on the marching band population, athletic training interventions for marching band, and as well as the technique issues that are present in the marching band setting. So as far as implications, there is a limitation as far as research on the population of marching band and my clinical question. The impact on athletic training could be beneficial to the population of marching band in multiple. They already cover multiple sporting events such as football, basketball, baseball, things like that. So why not just add one more and have marching band? It's not really even a contact sport, so it's not a priority as far as football and basketball and things like that. So the lack of education for those members could make you aware those injuries do occur, and they're not treated properly, so chronic ankle instability could present itself. So therefore, athletic trainers should aspire to do more research and conduct more studies to be able to help that population that doesn't get as much health care. Cool. So as far as acknowledgement, I'd like to thank the JSU Student Symposium for accepting my abstract. Thank you, Dr. Chris Clark and Dr. Jennifer Savage, for your guidance and helping me put this presentation together. And thank you to my classmates for all your support and everything like that. Here are my references. And any questions?
Any hope or plans to maybe implement a study on the ground here at KSU?
So I was a member of Southerners, so that's why it's a little close to home, a little close to heart a little bit. I would love to be able to conduct my own study or have like the athletic training program like conduct a study with the marching band, since we're one of the largest marching bands in the United States, with like over 500 plus people. So I feel like that's a really good number compared to a high school or even most other college marching bands where they just have maybe 100, 150, but we have 5 times that much. So I feel like the population and the results that we got with that would be very beneficial to the activity and the profession of athletic training. Yes.
Would you, as far as research questions, are you going to be asking things like, does the jazz step cause more injuries than the crab walk, or what have you, different? So the
thing with the whole each technique was that they all had a similarity of being in that plantar flex position, being on the balls of their feet to prevent that, or while being on the move, doing direction changes, which caused that center of gravity to move, which is the mechanism of injury for the ankle injury.
Sure, but I just imagine that, like, for instance, with the color guard, there's a lot of like power and speed, while with the drummers you've got a lot of weight. So I wonder which factor, if that matters.
Oh, yeah, and I think it would, and see, so like for percussion as an example, you're putting so much weight forward, which changes your center of gravity. So it's like that could also be more likely for an ankle sprain to occur. And then color guard, they're doing so much choreography, spinning around, changing directions, that could also change center of gravity for the ankle injury to go. So I mean, like I said, there's so limited research on the activity. It's like you don't really know, but it's just really like the information you learn and you apply it to that activity.
Sure. Other questions for our speaker? All right, let's thank him again.